Hello, and welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sian. Thank you so much, as always, for taking the time to join me, guys. I always am so grateful for all the support. And as always, I have a big request right off the top, and that is if you get any value from this conversation, please do share it. Put up a link on LinkedIn, put a screenshot up on Instagram, whatever, Facebook, wherever you like to spend your time online. Tell a friend, send a text message. Let them know that we're having these conversations that are, I think, going to be very helpful and valuable and impactful for all of our colleagues and for the profession as a whole. Before we jump in and before I introduce my amazing guest here, I want to say a big thank you to OSI. We are at the OSI National Summit here at the White Oaks Resort in Niagara-on-the-Lake. So I want to say a big thanks to OSI for giving us the space. Also a big shout out to our video production team, LCA Productions, amazing team with this beautiful setup. Every time we work together, they make it look impeccable. So I'm always grateful to work with them. And now, amazing thank you to our wonderful guest, Dr. Patrick Simard, who is an amazing myopia management guru. I am excited to have him on. He literally, it's one thing to say, we were joking about this earlier, it's one thing to say somebody is an expert. I can go a next level and say that somebody's a guru in this space. It's a rare air when I get to say somebody actually wrote the book on myopia management or whatever specialty we're talking about. So Dr. Simard has written a book on myopia management, one child at a time?
Exactly,
That's
called. Correct.
I didn't have it in front of me, but I'm glad I remembered. Great book, and really helpful for me as I was getting into my myopia journey. But a little bit more about Dr. Simard. Graduate from the University of Montreal in 2002. He's a clinical instructor and lecturer still there. He is a partner at, now I'm going to butcher this, but I'm going to try. Clinique d'optometrie Bélanger.
Well
in
done.
Montreal.
Good job.
Okay, but we're going to talk about a bunch of different things. I'd like to quickly tease off the top, but we're going to talk about getting into business ownership, different types of partnership, and Patrick's going to talk about his journey into that. We're going to talk about the journey from primary care into specialty care, and then we're going to dive a little deep into myopia management since that is his specialty. What's hot and new in myopia management as well. So, thank you, Dr. Simard, for being here.
Thank you for having me.
My pleasure. And I know that was a very big, long introduction. But anything you'd like to share that I didn't mention about you, about your career right now?
Fair enough. I'm still wear many hats.
Yes.
So you resume quite what's important for the talk today.
Fair enough. You do wear many hats, and as I mentioned off the top, we're going to touch on a couple of them, right? So I want to say the arc of the conversation is from early in your career as primary care practitioner into super specialty care. But a big part of that is going from an associate to an owner. So maybe let's start with that. What was your journey from associate to ownership?
I was lucky enough at the beginning of my career to end up with private group practice, at the time an OSI member. And I started with primary care, so the full scope optometry as we speak of. And I'm old, but not that old enough that 1 year into practice, we got TPAs in Quebec. So I was
that's an important landmark. Yeah.
Fortunate enough to basically start my career with that opportunity up front. So my goal over time, that's why I started a research master degree on keratoconus, was to move from primary care to specialty contact lens practice. So very early on, I was approached by my partner at the time to be part of the group and become a co-owner with them. I thank them. It was a huge opportunity, and it allowed me early on in my career to choose a path and to be involved and in the process of designing my clinical environment.
Right. So when you become a partner now, you're obviously invested, literally financially invested, but also like emotionally now invested in this business, and you want to cultivate the type of practice that you want to work in, right? So that's an interesting opportunity to come in early as a business owner, as a business partner. What was the decision-making process? Was it an easy, hell yes, I want to do this, or did you have to think through what your journey would be?
It was quite an easy process to go into ownership. In fact, I was looking to practice in that type of environment right from the start.
Yeah.
And I had that attitude, entrepreneur attitude,
There you go.
that
Okay.
you
That's
want
important.
to create something and to look beyond only patient care.
Yeah, that's actually very interesting. Something I wanted to ask you related to this, and you touched on it already. I want to look at this from both sides, owner side and associate side. So from an owner side, you're already talking about it, but what should an owner look for as in somebody that is an associate and they maybe are thinking about bringing them on as a partner? One is this sort of entrepreneurial mindset.
Ambition. If you find someone really ambitious, they want to get involved early on matters that are not supposed to be managed by those associates. I remember at the time I wanted to get involved into the price list, even though I was not a co-owner. I managed to convince the owner to buy a topographer at the time,
Good.
even though I wasn't an owner yet. And they agreed because I came up with a business plan to start to do orthokeratology early on. At the beginning, at the time we were talking about early 2000, it was not trendy to do orthoke on kids. It was quite a challenge.
I see.
But we jumped in, and from that I started my myopia management journey with that first device. It doesn't take a lot of device to get going. I'll say a topographer, it's a nice start, and then you can start building skills over time.
Absolutely, absolutely. I think you need some sort of investment to really lean into the specialty, but I do like to say to our friends out there, colleagues out there who are thinking about getting into myopia management or would like to get into it, you don't need that machine right now to get started. Like that, don't let that be your obstacle to start, but definitely keep it in mind that you should invest in that soon. And topographer is one piece that's been really useful for us too. So we talked about that. That's really helpful. From a business perspective, business owner's perspective, I should be looking for somebody who takes initiative, who's ambitious, who's asking questions. And I think now let's flip it from the associate side of things. What should associates be looking for in a practice that they want to partner in? Before you answer, I want to say one quick thing is I think associates should understand they have more power than I think they realize. Like you convince the owner to buy a topographer. Yeah. As a business owner myself, if an associate is ambitious and takes initiative and comes to me and says, Harbir, we could do more business, or I think I could build this side of your business, I would be very interested in that conversation. Not like a little bit, like let me take you to dinner and let's sit down and talk about this. So I think associates should understand that they have that power if they are, that kind of go-getter type of person. Yes. So tell me, from your perspective, you were that associate who bought into this practice. What were you looking for in the business?
I was really looking for to help growing the practice. And we did. We managed over 15 years 3 renovation.
Wow.
Of the clinic. So we passed from a 3-lane clinic to a 9-lane clinic.
Wow.
Double 2 times over that span in terms of clinic. It is impressive, and it shows a different path for an owner that owns a complete amount of the clinic, that there's a way to keep independent optometry alive by letting some piece over time to new blood, and the new blood will help shape the direction and the success of the clinic.
I think one of the things that owners are afraid of is if I give up part of my business, a percentage, I'm going to make less money, but also giving up control, they're afraid that they won't have a say or control the way the business is run. But, I think you're saying that a bigger pie actually is better.
Exactly, and I've lived through that aspect of it, where over time we grow so much that the pieces given by the initial owner was lower than the increase in the amount of the.
They ended up actually making more money in the long run.
Much more.
And
that owner already has his buyer for the retirement.
So that is an important...
A huge aspect of it. So
Yeah.
retirement can be planned 10, 15, 20 years ahead. And right now, I'm in the process at identifying who's going to buy my share in 20 years.
Yeah.
And the good thing is there is still some people that want to get involved. Some OD thrive on that, they're looking for that, and they want to be owner of their working place.
That's actually a really, really important point, because I think there's a lot of people, a lot of our friends and colleagues out there are weary of the fact that there's private equity and big buying groups and things, or groups that are rolling up practices and that, and perhaps they don't want to go that route, but then they don't know how to avoid that. How do I keep my business private, my practice private and independent? And I think what you said is so important, is start thinking about it really early.
Yes.
And by letting other ODs come in and buy shares, or a percentage of your business, you're giving yourself a good exit plan 20 years down the road.
Yes.
That's a really, really good point. And one thing we were talking about earlier, I just want to quickly share this, I think is important. As one of the questions that owners might ask is, well, how do I find these associates? Perhaps you have those associates in your practice now and you need to groom them. But I was mentioning to somebody else just recently that we have to think about, we market to our patients. Imagine we're marketing a specialty. We're talking about myopia management. We can look at what is our current patient base. What patients do I have right now who could benefit from this? But then now I have to do external marketing to bring some of those patients in so I can grow this specialty. We should think about that, recruiting ODs the same way, or even staff the same way. What does my website say about my business, and is it going to attract the type of OD that I want working in my practice? What does my social media say about my business? Is it going to attract that? And I think that's something that's going to become more relevant now with the younger generation of ODs. They're going to scout these offices and businesses and to see if they align with their values and what they want. So I think that's something that we should be thinking about. Again, we're thinking 20 years down the road, when I'm going to retire, I'm going to structure my website so I'm attracting those ODs. So 20 years later, I have an exit plan, right? So there's different layers to this plan of ours. Okay, so we talked about you getting into ownership. Let's talk about your journey from primary care to specialty care, because you said buying into the practice was an important step.
So over time, the clinic grew, and I was able to allocate more and more time to the specialty, whether it is scleral lenses, specialty contact lens, or myopia management. And right before COVID in 2019, I fully committed to allow all of my time to specialty contact lens.
So it took some time. I mean, for you to, we're talking a 12-year timeline from primary care to slowly more specialty to now ultimately only specialty care.
Exactly. And now 5 to 6 years after, I must admit, for me, it was quite the right choice. At the beginning, I had the fear of missing part of the optometry scope. I'm really grateful to the team of OD I'm working with, because they can manage other aspects of optometry that are also quite important, while I focus on what makes me more passionate about my work.
I think that's actually very important part to talk about as well, right? You built this over time, but within your practice, you have other ODs that you can refer to for other specialty care, whether it's dry eye or VT or whatever, primary care even.
We are a team, and each ODs kind of have their specific identity and their clinical space to operate within that. That's part of our success.
What advice would you give to somebody? I know, of course, you're in myopia management, specialty contact lens, but I think there's so much overlap in as far as like the strategy to become a more specialty care doctor. What advice would you give somebody, whether they're in dry eye or some specialty contact lens or myopia, and they say, well, I'm mostly seeing primary care. Let's say I'm 80%, 85% primary care, 15, 20% specialty care. What steps do you think they should take, step 1, 2, 3, to kind of lean in that more specialty direction?
I think the first step will be to identify the right balance you want to have. Okay. It's okay to only do 20% specialty care and take care of the the rest of your population. But if you want to increase that specialty aspect of your practice, you need to seek for knowledge. And the first thing, you don't need a residency to start to be a specialist.
I appreciate you bringing that up.
Knowledge is up there. Everyone can access it. The only thing you need is the proper patient base and clientele, and this is what you need to build over time. So the first step will be to commit time to train yourself. There is some specialty meetings around the subject you want to do. Really important to create your network of ODs, already specialists in that area you want to focus on. Those kind of guys just want to share their knowledge, just want to share their path, their walkthrough.
Yeah, that's so true. Actually, I think we worry sometimes that our colleagues, maybe there's a concern about competition, but the more you specialize, I've learned this lesson myself now, through meeting amazing people like yourself and David Ng, we were just chatting earlier, and Sherman Tung in Vancouver. As I lean more and more into myopia management and into ortho-K and this kind of thing, the people who specialize, they're so passionate about what they do. They just want to share. There's no aspect of competition, even if, like, for example, Sherman, he's a 30-minute drive, 40-minute drive from my office. It's not that close, but it's close enough that people will drive for specialty care. But when I ask him, I used to refer patients to him, and now instead I said, Sherman, I'm going to keep these patients now. And he was like, please take them.
Help me.
And not only, exactly, he's like, there's too many patients for me to see by myself. Yeah. That's one thing. But not only that, anytime I text or call him, here's the answer to your question. Here's how I do my structure, my fees, or here's how I address this issue. And I feel that really from everybody I speak to in the space. So I would encourage, again, whether you're dry eye or VT or whatever, the more niche you get, the more you're going to find your tribe. And when you find that tribe, they're going to really support you.
Yeah. And if we go back to how you build your specialty, the next step will be to build your referring network.
Oh, yeah.
And the referring network can be within your group practice. So you want to make sure to clarify what kind of patient you want to see. Criteria list. So you send me that patient at that moment clinically. This is where I want to see it. And you'll see it back at the end when I'm done with my specialty work. This is inside your clinic, and you also need to do it outside your clinic.
Right. So I wanted to ask you about that. So when you're developing your referral network, other ODs, maybe GPs, if we're talking myopia management, are we talking pediatricians? What type of doctors or referral network are you developing?
Every network, and sometimes it's always a word of mouth, usually. Right patients, some patients are very vocal about their experience, and they talk a lot about it to the pediatrician or their family, and so every referring patient by word of mouth
is so valuable, that word of mouth referral. I wonder if let's say we're talking about connecting or creating that referral network with other ODs in the area, right? Not within your practice, other ODs, you say, listen, I do myopia management or I do ortho-K. If you don't do it, when you have a patient, please send it to me. Do you go about, how do you go about, is it just a phone call? Is it an email? Or do you go in person and talk to them? What would you suggest?
In my case, I was lucky enough to teach at the school.
Oh, right. Okay.
So basically, right from the start, I had a touch base with those future OD.
Yeah. That's a huge advantage.
That
gives you a lot of notoriety,
advantage.
Right? Of course.
My advice will be really to make sure you clarify what type of patient you want. An example, 10 years old and younger, progressing at a very fast pace, those are ideal candidates for orthokeratology. So if you have someone who's doing myopia control with soft contact lens, multifocal, anti-myopic glasses, atropine, but don't want to jump in right now into orthokeratology, that's where you can be a valuable referral center for that place, and only take care of
That one
those
thing.
patients.
Got
That for them, they don't see that type of patient every day. It might be once every 2-3 weeks.
Yeah.
But for you'll get many
From
referral
different
sources,
sources, right.
and you'll be able to specialize over that kind of patient.
Got it. And so as you that referral network, as they start sending you more patients, then you can start to change your patient base and how many specialty care patients you're seeing versus primary care, as more of those referrals will come in. I want to, if it's okay.
And reports.
Oh, good. Yes.
Sending back
Very
a
important.
report. This is where you can show appreciation
Yes.
for the referral.
Yes.
And also improve their clinical skill by putting some teaching stuff into the report, so they build also their confidence over myopia control.
The other doctor that
The
you're
other
sending.
doctor,
Yeah.
because it's
That is such
education. It's all about education,
Absolutely. And that's actually really valuable, because we are supporting our colleague who sent us a referral. First, like you said, appreciation is the number one. Thank you so much for the referral, but also helping them kind of come up to a little bit more up to speed. Perhaps they are going to, maybe they start seeing more myopia control themselves. That's fine. Again, that's better, bigger pie for all of us. But maybe they start to see more patients that could be referred to you. Like they start to realize that there are more patients they could send to you based on what you've said back to them. I want to say one key, there's actually two things I just want to expand on very quickly on that. This really, really all very useful information. So on the note of I want to talk about the report in a moment. But first, as far as building your referral network, if there's any ODs who are listening who are thinking they want to reach out to colleagues and start to get more referrals, whether it's for dry eye or for myopia or for whatever it is, one thing that I did is I sent my staff to make the initial point of contact, but then we followed up. But I created a little pamphlet or a brochure in Canva. And I've done this before on the podcast because I create templates for different things. So if there's somebody out there who wants to see what I created as far as a brochure, just email me, info@the2020podcast.com, or you can message me on Instagram, and I'm happy to share it with you. But basically, I created this little brochure, and it says, here's what we do in our office. We want to collaborate with our colleagues, and we're only gonna see them for this, and we're gonna send them right back to you. Kind of reassure our colleague about that, and talk a little bit about the technology that we have. For dry eye, we have the radio frequency, the IPL, or if we're doing myopia management, we do orthoK. We use this topographer. But to your point, then also specify a little bit what type of patient we would see. We don't want to see all your myopia patients. Let's just see the orthoK patients, right? And here's a topographer we use, and here's the lens we use. So if anybody's interested in that, I'm happy to share that with you. But so I had my staff go, they took some cupcakes or something, and then they went and they said, here's the pamphlet. And then we got a little bit of engagement from some of the doctors that way. So that was one step that we took with ODs in our area. So I don't know if you have any thoughts on that.
That's a great way.
Okay.
You
I was
need
looking for a compliment.
to create
Thank you.
contacts, a huge way.
I want to talk about the report really, really quickly. One of the things that is such a burden for many of us is like writing referral letters and writing reports after. Your EMR can help you so much in this if you have templates for everything. If you create a good template, so we have a template for a report that I'm going to send for myopia. I click that, it's linked to the patient, it already draws the information out from the patient, refraction, axial length, all the other things, and then I just type a thank you, here's what I saw, here's what we did. And so just a quick shout out, we use Optisys as our EMR. So if you're using something that doesn't let you do that, I would highly recommend you look into this program. I think it will be very, very helpful for you.
I totally agree, and don't get me started on Optisys. I'm a huge fan, and I'm a long-time advocate of that EMR.
I knew it. We could have a whole podcast series on Optisys and the functionalities and all the things. Like not even just one big podcast, multiple. And for those who do use Optisys, you know this because there's webinars happening like every few months. There's a webinar on this feature or that feature. So we only use a fraction of what its capability is, but when we switched a couple of years ago, we found it hugely, hugely beneficial to our practice. So anyway, we can go on that tangent all day long. So let's talk about myopia management a little more detailed. You are the guy who wrote the book on myopia management. Okay, let's talk about from entry level or lower, for our friends and colleagues who are beginner level, what advice would you have, one or two pieces of key advice? And then we're going to go super, advanced level, what's like really new and happening. So let's go entry level for our colleagues first.
First of all, it's a great time to start myopia management. And Canada is a great place to start myopia management because we are one of the first market for almost every technology in the world.
Very interesting.
Because we have a diverse patient base and a lot of proactive doctor. Being very proactive in that, what I think should be the first thing in mind is to make sure we understand properly that there is no safe level of myopia. And we need to treat myopia much earlier than we thought. So being a -1 and being 9 years old, it's not normal. And we know that the kids will progress more and more. And we know that we are even moving towards more preventive care. And we now have scientific evidence that we can even act earlier than that. We can act in the pre-myopia stage. So when we get a patient losing that hyperopic reserve for the age, this is a sign that the patient will become myopic. And we have data showing that atropine is effective in those kind of situations to delay myopia apparition. And also there is now some data that will come in the next year on the effectiveness of anti-myopic glasses on those pre-myopic patients where you only wear the glasses 3-4 hours a day.
Interesting.
And you can delay myopia by 50%.
50%, wow.
So this is huge.
That is huge. Okay, so that's a really important topic that I like to talk about as well. So for those of our colleagues who are a little earlier stages of myopia management or just starting to get comfortable with it, I think the concept of treating pre-myopic kids makes them a little uncomfortable, but and especially with a pharmaceutical agent. Now, I can say I do have a couple of patients who are, 6 years old and plus a quarter when they should be, they should have significantly more hyperopic reserve, or 6 years old, 5 years old, emetropic or something like that, that I have started on. And there's family history, their older siblings myopic, there's enough of that list of things that we need to see, and they're on atropine, and normally we would say, well, this child's emetropic, they're good to go, but there's much more to it. So that's one thing. But for those who are very hesitant about the eye drops, the fact that we can just put on a Plano prescription with one of the myopia control lenses that's available and see potentially a 50% reduction in progression or risk reduction, that's huge. That's huge. That makes it so much more accessible to our colleagues who are a little hesitant. Now, all you have to do is say, listen, wear these glasses after school, at home only, right?
For homework.
Homework, 3 hours a day when you're watching TV and you're doing homework. Like it's a pretty easy entry point. And I think, I know some of our friends out there, myself included, may already be prescribing low plus for near tasks and stuff. So those kids are already potentially going to be wearing glasses for a couple hours a day anyway. Right? So we have an opportunity there for sure.
Definitely.
So that's great. What about really advanced level? What's cutting edge right now? Maybe doesn't have like the full backing or full scientific support, but you think is coming up soon? Like red light, is red light something?
I think if I may add on other optical solution, we'll have many new soft contact lens design coming out the market in the next couple of years. This will broaden our toolbox to do safely soft contact lens. In terms of orthokeratology, we move from more conventional fitting to more customized design, more personalized approach to mold each patient differently under ocular parameter like pupil size and the shape of the cornea. And there is those out-of-the-box kind of solution that we don't know yet if there's going to be a valid option. Red light therapy is one of those, where right now we know that the time of exposure, the energy level was quite toxic for the retina, so they stopped making that available. But there might be some room in terms of changing the energy level or the time of exposure to make that option a bit more safe for our kid as an add-on therapy. So this is something that can be done. In terms of pharmaceutical, atropine right now has many problems in terms of formulation. It's not stable in the bottle, doesn't go into the eye at a regular concentration. So there is some company trying to get FDA approval that solve those problems, where the compound is stable for almost 2 years.
Oh, wow.
And
Okay.
that shows that the level of atropine reached the retina
Yeah.
because it's pH appropriate and with right penetration into the ocular surface.
Yeah, that's definitely one of the downsides of atropine is, of course, patients got to go to the compounding pharmacy to have it made every time and every month or how frequently they're getting the bottle. But I found with some patients who've been on atropine for a while, all of a sudden they're like, oh, I'm so sensitive to light since last month. And I was like, well, we haven't changed the concentration, but just the small differences in the compounding or how much is absorbed and these kinds of variations will happen.
That's one of the problems. So I probably predict that all we know about atropine will be rewritten in the next 5 years with those different formulations that will provide more scientific evidence that we can go with different dosage and concentration.
One more question on the atropine note. I think there's some debate or questions about what is the mechanism of action? Can you share something on that?
It's not fully known, but there is a cascade from the retina to the choroids, and the choroids that goes to the sclera that will inactivate the fibroblasts that will create eye elongation.
I got you. So it's got an effect on the choroid is the key, ultimately the key effect.
Ultimately,
so strengthening the choroid, reducing axial elongation. Got it.
That's why eye penetration is such important. And because we have eye with different eye length, we might have different level of atropine concentration at the retinal level.
It has to travel further. I got it.
So there is a lot we don't know yet.
Yeah. Fair point. Okay. Well, Dr. Simard, this was really enlightening. I think there's so much, whether somebody listening to this is into myopia control or not, whether they're a business owner or not, I think they can learn so much from everything you shared here. Anything that you wanted to mention or talk about that we didn't talk about yet?
If you hesitate to go into myopia management, it's the right time just to jump in. And it doesn't matter if you don't master all the toolbox, just start with the one you feel comfortable with and build on that. Don't worry, in 5, 10 years, 15 years down the road, you'll master all the toolbox.
Yep. Just got to give it some time. Actually, I'll give you one more thing here. If you want to take a moment to plug OSI, talk a little bit about the benefits of OSI.
I'm a huge fan of OSI. It's an amazing platform to remain fully independent, meaning that you can design your own business from all aspects of it. So you have support. I'm a huge technology guy. So for me, you were talking about ERMI. Optosis is a game changer. You train staff quite easily when you hire people. You can modulate your workflow into the clinic. more efficient in the exam room, generate reports, KPIs. There's the support is there with that software to thrive as an independent optometrist. And you have all those additional benefit from OSI, which is training, in clinic training, the buying group, which a huge facilitator by having regroup all your buying stuff. And those summit right now, we are a summit where we can exchange expertise and learn from each other. Those are fabulous.
Absolutely. Actually, I would find that maybe the most valuable. All of those other things you said are very, very valuable. But for example, yesterday, sitting in the room with other clinic owners, sharing ideas about what's working, what's not working. And that is probably the most valuable thing that I find as being a part of OSI and coming to the meetings and sharing. You know, I always say this, there's, when you go to a conference, there's CE, right? Which we're skipping right now to record this. There's CE where you get credits and you learn. In the lecture hall, there's lecture hall CE, and then there's what I call hallway CE. And I love that about coming here. What I learned from people like yourself and others as I'm walking around and we just happen to have a conversation, or last night before, you know, at the end of the night, we're sitting around and chatting. Those are the types of conversations where I really learn. And this is a great space for that.
Yeah.
So anything else, or we're good?
Thank you
My
for
pleasure.
having me again
My
on
pleasure.
your podcast.
Thank you for coming on. I know it's been a while. I've been wanting to have you on, and I really appreciate this conversation. So thank you, Dr. Simard. Thank you to OSI once again for giving us the space here at the National Summit at White Oaks Resort in Niagara-on-the-Lake. Big thanks to our team who are freezing behind the camera here, the LCA Productions team, for doing an amazing, look at this fireside. They set this up.
It's comfy. I like
showed up here,
setting.
I was like, hey, where can we record? And we come out here and they move some furniture around, they light this thing up and give me a beautiful light, and perfect, beautiful. So thank you guys for making this look so good. If you're not watching this, if you're listening, get a chance, go on YouTube and just look at how lovely this all looks. It's cozy and warm. Makes for a great conversation. So thanks to those guys, and thank you to everybody who's listening and watching to the 2020 podcast, Canada's #1 optometry podcast. We'll see you guys in the next episode.